What we need to know if you're dealing with neck pain is which way are things actually locked out of position. Hi, this is Dr. Jeffrey Hanna at Atlas Health Australia, and what we do all day, every day is we help people who have been dealing with long-term issues with their necks. And I want to show you a few things using that little model right here about what we oftentimes find and why is it that you are most likely experiencing some kind of neck pain, but why the different kinds of remedies that you've also tried so far may or may not have worked. So let's start with just a little bit of brief anatomy. So I've got this blow-up model of the back of the neck here. And in between each of the bones are going to be a series of, oops, you can't see that. So between there and then between there, so this area there, this area there, there's going to be all these joints. And what a joint is designed for is it's designed for movement. And in the upper part of your neck, that's what's going to be responsible for this movement and then this movement, so up and down, side to side. So if you ever were to suffer some kind of an injury that damages the integrity of those joints, it's not broken, it's not dislocated, and there may or may not have been any blood. But the point is that it injured something by even 2 to 3 millimeters. Then what it can do then is it's going to change the internal arrangement of how those joints move. Now this is the really important part here. There are in the neck, there are 3 basic kinds of nerve receptors. There are what are called sensory nerves, the ones you feel, motor nerves, the ones that move things, and then there are what are called autonomic nerves. Autonomic nerves are what are going to be responsible for blood flow, organ function, all the stuff in your body that keeps you alive. Now here's the thing, only the sensory nerves are actually sensitive for pain if there is irritation to that area. So what I'm saying is that you can have something that's disrupted any of these joints or any of the nerves on the inside, and if it affects the sensory nerve, you're going to be experiencing a certain degree of neck pain. However, if it's affecting the different nerves, you may feel nothing at all. So a lot of times people, they walk around like this for a long period of time and they say, okay, no, I feel fine, there's no problem. And people will attribute it to posture or just getting older or different things like that if they do get the odd little niggle or something like that. And usually that comes, the pain or the niggle or something like that comes when there's irritation to one of these nerves. So for example, you've been in front of your computer for too long, in front of your phone for too long, too much sewing, too much hobby work, all of these different kinds of things there. Now, in and of itself, those activities, they are not what created this stuff in the first place. It's usually the result of an old injury, something that never healed, never resolved properly. And now what happens is down the track, this problem has been growing and growing and growing, and you're wondering, okay, well, what do I need to do about it? Now, most likely, if you've been dealing with neck issues for a long period of time, you had somebody try to rub those knots out, be it a spouse, be it a massage therapist. You've probably done different kinds of stretches or activities trying to stretch things out like this. But what you find is that everything just keeps tightening back up. So you maybe have even been to a chiropractor, physiotherapist, somebody like that, to see if they can loosen it. And sometimes it works, yes, but other times it doesn't. And I want to show you on the little model one of the major reasons why we find that that is. And it's because what we do here at our practice in particular, we're looking at each joint separately. So what we do is we do a series of tests looking at your neurology, looking at your structure in ways that are not commonly considered to find out, okay, is something locked either forwards or backwards? And what we actually find, despite the way that a lot of times muscle work and things like that are done on the back part of the neck, what we find is that the majority of misalignments have actually gone forwards. And so what it means then is the care that we need to do is going to be in the exact opposite direction to bring things back to neutral, and that when we do that, we're able to see all of these different kinds of changes, including for people who have been dealing with neck pain and other problems for a very, very long time, but have never found any long-lasting relief. So, I hope you've enjoyed this little video here, just giving you some better idea about when we're looking at, or if you're experiencing neck pain or something like that, what is the role of the neck, and that based on how things actually have gotten stuck, misaligned, or if there's other problems going on there, how we may be able to help. So if you've enjoyed this video, please do like it, share it, and let people know. If you have been experiencing neck pain, or if you know someone who's been experiencing neck pain, please let them know that there may be a solution out there. We'd be happy to help in any way that we possibly can. This is Dr. Jeffrey Hanna at Atlas Health Australia. It's the Brain Body Connection.